Good morning to all of you. Welcome to Legal Matters by Saibo Sunkara. In this video, we are going to discuss a couple of cases regarding the involvement of Nhrc or cases decided by the National Human Rights Commission. These are all actually the very good remedial measures for two types of persons. One is physically handicapped. So this is allocation of seats in all medical courses for the physically challenged person. Actually, a physically disabled person or physically challenged person, Divyangudu antam kada manam. He approached the commission stating that there was no provision of reservation for the differently abled candidates, as a result of which he could not pass the entrance examination. No doubt. Only merit will carry on. But please remember, the commission called for a report from the Deputy Registrar of Delhi University. Then the Deputy Registrar stated that there is no provision of reservation in MBBS or BDS courses for the physically challenged people. Therefore, please remember, there is an act called as the Persons with Disability Act 1995. There it is clearly mentioned they have to reserve 3%, I think, 3% reservations for the physically challenged candidates. So therefore, after studying the provision of law, they directed the Deputy Registrar to comply with the Act. Ultimately, Supreme Court also has given a judgment in this connection which provides for 3% reservations. From that onwards, yes, even in MBBS and BDS seats also, the physically challenged candidates are getting 3% reservation. Yes, their rights are protected by the Nhrc. Please remember this. This is a very important achievement, actually, by intervention. So normally, fake encounters or hunger deaths, all these things we have discussed in the last videos. But here is another actually social issue. Then medical treatment to a patient suffering from AIDS. So acquired immunodeficiency syndrome, AIDS. So please remember, the Nhrc received a complaint from a patient that he is suffering from AIDS and he is being denied by the doctor of the government hospital. Even in the private hospital, so they are denying treatment. Actually, he was admitted in Apollo Hospital, Delhi, and later Loknayak Jayaprakash Narayan Hospital also for a couple of days. But no dialysis could be given to him because there is a doubt of the so-called extension or the transgress of the so-called AIDS to the other patients. They have refused. Normally, in olden days, about 10 years back, whenever any AIDS patient is there, people used to vacate the entire area. When he dies, he will be taken to the outskirts of the village, then only the body is burned. They will not allow his body to be burnt in the local cremation ground. Such was the condition, of course. Nowadays, after knowing that it is not so dangerous and it is not spread, it is not a spreading disease, so people are satisfied. But anyway, still this is being continuing. So the patient could not undergo dialysis because he was an AIDS patient. The commission called for a report from both Apollo Hospital and also Loknayak Jayaprakash Narayan Hospital. Right? Apollo Hospital reported that the patient was clinically stable and he doesn't want any dialysis. The other problem. So, as far as the medical ground is concerned, there is no necessity for him to undergo the dialysis. But he is afraid. Since he is an AIDS patient, he is under the impression that he has to transfuse or he has to change his blood. There is absolutely no necessity for him as opined by the Apollo Hospital. Right? But please remember, Loknayak Jayaprakash Narayan, they stated that yes, the treatment needs dialysis. See, conflict of opinion between both the hospitals. Anyway, so following the intervention of the National Human Rights Commission, Loknayak Jayaprakash Hospital, yes, continued with the rest of the treatment. Of course, I don't know whether the person is totally saved from the AIDS or not, but the intervention of the National Human Rights Commission made the hospital authorities, that is Loknayak Jayaprakash Hospital, to continue the treatment to the patient. Once again, please remember Article 21 of the Constitution of India, that is a right to life and liberty of each and every individual. Even every charter or every international covenant, so economic right to self-determination, like that, every covenant will treat that definitely right to life and liberty, right to life and liberty shall be protected by law. This is article number 6 of the ICCPR, article 21 of the Constitution of India, and definitely right to work, right to farm, right to health, right to free education, like that. It is also in the ICSCR. So please remember, right to life is a fundamental right, it is a human right, it has to be protected by the government. If not, the NHRC will take up the issue and definitely it will intervene and protect the people's rights. So with this I am closing 3 videos I have made. Please read them and enrich your legal knowledge. If at all the question comes in the examination paper, you must be ready to answer. With this I am closing the video. Thank you very much.